Hello and welcome to Psychological Insights. Last month we talked about the politics of gender identity and the lonely male. This month we're going to be talking about health, mental health, and aging of the male. Are the issues of the male different than those of the female? And why? What is different? What makes the male aging different than the female aging? I'm Pat Kazakoff, and you're watching Psychological Insights. Stay with me, and we're going to be speaking to Dr. Robert Hamm. Hello, Dr. Hamm.
Hi, Pat.
So tell me, what's the big deal with the mental health of the male? Why is this a concern? Why is it a topic?
I think that it should be something that's brought more into the attention of the public. The American Psychological Association had recently come up with guidelines, as I discussed in my first blog last year, for dealing with men's issues. And I think that with all the attention given to aging today and gender issues, I think that one of the sort of ignored topics is I don't know, it's sort of like when Richard Nixon was president years ago. I'm dating myself, but talked about the silent majority. There's a lot of aging males out there, and they're affected.
They have problems.
Well, everybody has problems. Their problems are unique, as everyone's.
And so what is unique about their problems? Like, why are we focusing on their problems? Why don't we focus on the women's problems?
Well, we do focus on women's problems and other issues in life as well. And so this is just another interest group, a group that does need to be examined. But moreover, more importantly, men, I think, are less vociferous about their issues, partly because of the issue of what it means to be a man.
So what is the big issue? What are the issues that people are presenting when they walk into your office? What are the issues?
There's a host of issues. In my private practice here in West Hartford, I see people of all ages, genders, and situations.
But specifically the aging male. What makes his issues so important that you focus specifically on him?
Well, first of all, to answer your question, somebody who comes into my practice, I have a general practice, may come in for a variety of different reasons. And that isn't what we're talking about here today. It's what underlies those problems. And so for a man who is older, there often are issues that are not being addressed that are contributing to the problems that he brings in, whether it's anxiety, loneliness, depression, relationship issues, or addictions.
So what is the issue that most of these older men come in with? What are they presenting with when they come in to see you?
Well, once again, it could be any of a host, the ones that I just delineated.
Is there one that's more prevalent than another?
I haven't really given much thought to that. It seems to be not really. Nothing really stands out. They're all problematic. And sometimes they come in bunches, relationship issues, addictions, depression, and sometimes anger management, self-esteem issues. When I see a person, it's not just usually one. There's a prominent symptom that comes in. Someone is in a relationship that's not going well. Someone is struggling with alcoholism or a sexual addiction, or someone is having difficulty with their career or not feeling confident enough. It could be any combination of those issues and then eventually in our work, as I'm exploring this with a patient over time, and usually quite readily, I'm able to pinpoint some of the contributing factors in their lives, their childhood that we explore, but also for an older man, often what arises is that what it means to be an older man.
What is an older man? What age do we talk about an older man?
Generally, I'd say, and it's just arbitrary, but it's generally 50 years old
50
and
and
older.
up.
But it could be in late 40s or even later in life. But it's more psychological. When one sort of reaches the peak and they start on the decline, we all look at the horizon of our futures and see that that life isn't going to go on forever, and we naturally then reflect back on who are we, what have we accomplished, what hasn't been accomplished, the bucket list in life, regrets, all of those things that start to come into focus.
And the aging part, like, what happens to a man when he's aging? Like, what are the behavioral issues? Are there certain ones that are specific to the aging male?
Well, people respond differently to stresses in life. So some people might succumb to addictions. Some people become isolated. Other people go the other direction and they're working too hard. Sometimes men, as a result, suffer from health problems, especially if they're isolated. Men are not as good in paying attention to how to nurture themselves. They're not attentive to self-care.
But when you talk about isolation, like most men have family lives, they're married, they have children by that age. Is isolation a word that is used to describe those men also?
It can. Today, marriage isn't what it used to be. A lot of divorce is much more prevalent. So even if a man has been through a marriage or two marriages, has children, and they're out on their own, it can be problematic in terms of the issues that men have to face in being alone if they don't know how to take good care of themselves. And men are deficient I'm generalizing, of course, but men are not as good as women are in connecting with other people, to pay attention to their needs socially and spiritually, and in terms of their physical health.
So why aren't they as good? Why aren't they as good as women are at connecting, at self-nurturing? What prevents them from doing that?
Partly because of what it means to be a man.
And what is that?
To be stoical. That you don't have to be nurturant or to accept nurturance from others is sometimes associated with weakness. That you should be self-sustaining, and the emphasis more is on virility and achievement, to be competitive, to be better than. You identify yourself as an individual, and your self-esteem is all wrapped up into that more than it is for women, who are more generally, and again, these are generalizations, socialized. They are socialized into being good to others and to be thoughtful, and therefore, as women age, they're more inclined to be better connected in networks and support systems, and to be attentive if there's something lacking in their lives, to be mindful. Men are they're sort of oblivious to these matters that at one time when they're younger didn't matter so much because they had their whole future ahead of them.
You could afford to be oblivious,
yes,
without
exactly.
a lot of consequence.
That's right.
And now, not so much.
Yes, let's say a man has been married for many years, and then he suddenly lost his wife. She may have passed away, or there's a divorce, and there are things that are taken for granted, and all the things that a man had perhaps taken for granted in his marriage, and all of the benefits associated with that. He is not as equipped, I think, as an older woman is in paying attention and taking care of those matters.
So how do you, as a male, how do you all of a sudden not take it for granted? How do you all of a sudden pay attention? What are the techniques that a man has to do to not take things for granted, to not be oblivious,
Yeah.
to be mindful? What does he have to do? Because that's a real paradigm shift.
You're right, it is a paradigm shift. And in answer to your question, nothing. There are no techniques. It's a consciousness raising matter, so to speak. So that's why I'm bringing this up as a topic to talk about, because in my practice as a psychotherapist, I have to bring it to my patient's attention.
So how do you bring it to someone? What do you say to someone? Say thank you when your wife brings you dinner? Like, what do you say? How do you tell this person to be mindful? Like, what do you do to make him conscious?
Well, I tell him that I have a blog and a TV show
Okay.
that addresses this issue, and there's a reason for it. And it's simply bringing to someone's attention. It's not like dealing with a personality disorder where someone is entirely, where they are very deeply defended against awareness. I think that it's something that men need a consciousness raising about, and having someone like myself, a fellow male, as their therapist, to bring it to their attention, gives them an opportunity. It's a great venue for this to take place. From the fact that someone is seeing me in therapy, right there I have a leg up, because they are looking for help. They are making themselves vulnerable. Now, the vast majority of men out there who have these problems are not in my office. They should be, and they're not. So they're not, unless they see this show on West Hartford Community Television or read my blog, they're not. And so the problem continues. It's under the radar for them.
Well, until it rises to the fore, until there's a cataclysmic event that says, you've got a problem. There must be some cataclysmic event.
Can be. No, not necessarily.
Not necessarily?
There can be cataclysmic events, and they'll deal with it on the surface level. They have a heart attack, and let's say, and so they address it by, getting a bypass surgery or exercise more. But the issues that are underlying whatever health problems and lifestyle problems and emotional issues were there often remain undealt with.
So how do you make a person more mindful? You have a 60, 70-year-old person, and they've been oblivious their whole life, and they haven't had a cataclysmic event. How do you train mindfulness?
Bringing it to their attention, this is part of what it is to be a man, and how we were raised. Really worked for us, the masculine imperative, to be dominant and aggressive and stoical. Really works for us, especially in our youth. But as we're older, we need to get in touch with our other side, like the yin and the yang, that men are not as well equipped to deal with. As we age, we need to become more nurturant. We need to be more mindful in connecting with other people. Are we giving to other people? Are we contributing as much as we should? Are we taking care of our health? Are we looking at our emotional lives?
So you talk about this with a male,
yes.
And over a period of time, the theory being that this conversation and this context enters the person, and they start thinking about it.
Well, exactly. We have to disentangle the relationship between all these basic needs in life from what it means to be a man, so that they learn that just because you are vulnerable and you're dealing with these difficulties in life doesn't mean that you're not a man. So a man has to examine this and then sort of reconfigure his definition of masculinity.
So how do men take to this? So you have a skewed population that's coming to see you because they've identified that they have some sort of issue sufficient enough to see a psychologist. So how does the process evolve? Like, are you successful with it? Do you see big changes in men? Because after all, they're older. You're dealing with an older man. Mm-hmm. Can they change?
Oh, yes. And this is the beauty of psychotherapy. If you have a good working relationship with the patient, they're there to work on their problems. And so they're admitting that they are not able to solve their problems on their own. That's the nature of psychotherapy. So that said, my advice and guidance enables them to look at themselves honestly, to re-examine some of their the values that they've held in life, and to reconsider the validity of those values and making adjustments accordingly.
So how, I'm listening to you, and to me this process seems that it can take a lifetime. Like, I don't see 1, 2, 3, 4, 5 sessions and you're done. Like, how
No.
long can this go on for? How long are they seeing you for?
It varies, of course, but it gets them motivated in making changes. Now, how that eventuates in terms of how it affects their lives, that takes time. But the insights and understandings that we're talking about in dealing with what it means to be a man and masculinity as we get older, those things we click right away.
What the understanding of what you're talking about, that they understand. But how does it translate behaviorally?
That takes time. That takes time for them to start to make those adjustments in their lives, to establish relationships as they should naturally, and making adjustments in their lives. If they have an addiction, to get involved in a 12-step program. If they need to exercise more or change some of their eating habits. If they need to get better connected with the community. If they need to just learn how to be more accepting of their vulnerability, and to be more transparent about those things.
So how does that look in real time, in real life? That you're saying, like, the male he's very conscious that he has to connect more with people, with what's going on around him. How does that look? How does the male do that if he's not accustomed to doing it? If he's just accustomed to in quotation marks, to being there?
It's a piece. It's baby steps. It's a piece by piece process. So I'll look at when I'm working with a patient, I try to get a broad sort of spectrum of their life and all the areas that they live in, pertaining to their lifestyle and their relationships and their careers, their hobbies, and all of that. We look at all those different dimensions, and we address which kinds of adjustments we need to make in order to get them to a place where they're happier and they're living a healthier life. But I think for men, I'm just thinking, Pat, as we're talking, it's kind of funny, but it's like, the old joke that men have difficulty asking for directions. And that speaks to, I think, what we're discussing here. Men need to learn to
ask for directions.
Ask for directions, and be more transparent about their vulnerabilities and their weaknesses, to accept that it's okay. It doesn't mean that they're a failure when they do so. Women, I think, are more capable in being vulnerable and accept their weaknesses and their emotions than men are. So that's a big piece of it, accepting our limitations and not attaching it to self-esteem.
Aha. So this, in the end, this all comes back to self-esteem. They don't feel good about themselves.
Oh, yes, yes. Men are raised, when we're younger, our self-esteem is attached to being strong and being accomplished and achieving in life and winning in a competition. All those things that, and not showing vulnerability, not showing weakness. Weakness is a sign, or vulnerability is a sign of weakness. And so men stuff it and don't look at those things.
So it comes out eventually.
Comes out in, that's right.
Eventually it comes out in bad behavior.
Comes out in different ways. And when we're younger, men have to learn how to, as you said, to do it in a pro-social way so that it doesn't get them into trouble. When men are older, they find that their weaknesses are things, their limitations are things we have to come to terms with. It is a natural process of aging.
Are they conscious of their limitations? Like when they come to you, do they say, hi, I can't do this, I can't do that? Are they conscious that they have limitations?
Yes and no. I think that we're all to some degree aware that age brings about all of these, but more, I think, often than not, the problem that is most salient in my work with patients is the symptom that brought them in. They want to alleviate whatever suffering they're going, and I have to, in the process of doing that, also go below the surface and look at what are the psychological issues, of course. I'm a psychologist. We have to identify those, and this issue that men have about aging and accepting the fact that that we also have needs and need to embrace those and to express them and be more transparent about them. That is perhaps one of the most challenging aspects of dealing with all of the things that bring them suffering that they're not aware of.
And can you really, really bring about a change? Because that's a little bit of hardwiring, isn't it? Like, can you really make a person more sensitive after the age of like 65? Is he going to see the sunset when he never saw the sunset before?
Yeah, I don't see it as hardwiring. It's our belief systems that we invest in, that we have certain sort of values and ideas and fantasies about what it means to be successful. And those are formed early in life, yes, but they're belief systems. They're not hardwired. And in order to be successful in life throughout the life arc, we know that we have to evolve, we have to adjust. That's just the evolutionary life process. And so by talking about these things, it allows someone to, through re-examination, to make modifications in what they believe is necessary to be happy. And one of those that we're talking about today is what it means to be a man, masculinity.
And so masculinity is identified as what? What exactly is masculinity or virility for a man? How do you define that?
Well, in my first blog I talked about this masculine imperative, that things that are traditionally associated with what it means to be a man, that include dominance, aggression, risk-taking, and stoicism. These qualities, we believe, is what it is necessary in order for us to be successful in life. And they are, to a large extent. However, it's very sort of distorted. It doesn't speak to the other aspect that women have a better, that are trained early in life, socialized to be more mindful of, and that is how to be nurturant and how to self-care and how to take care of others, how to be connected with other people.
So do men all of a sudden get that as they get older and become more conscious that this is a problem?
When they see me in therapy.
They do? How long
Well,
do they see you in therapy for? Like, what's the average time span? Seems to me to be a lifelong process. That's why I asked the question.
No, it isn't necessarily. I mean, people come in for different reasons, and I have some patients I've seen for years, others I see briefly. It depends on what you want to get from therapy. And some people feel that being in therapy on an ongoing basis is a good experience. It helps them to learn and deal with their issues. Other people are there more just to deal with a certain specific problem.
Has this problem, has it become more prevalent now than, let's say, it was in the 40s or the 50s? Like, has the psychology changed?
Yes, I
Like,
think
do you
so.
see different things in your practice? You're a mature psychologist. Do you see different things now than you did 20 years ago?
These problems always existed. It's just that they haven't really been addressed before so much. I think that there have been changes in society with the disintegration of the institutions that we used to rely on. So
Institutions like family,
family,
synagogue,
that's right.
church,
That's right.
religious institutions,
Yeah,
social institutions.
that provided a sort of like a safety net aren't there anymore. But as those institutions have dissolved some, there's been a raising of consciousness, I think, in society about all of these problems that need to be addressed at a psychological level?
Well, I mean, it's a big topic. It's a big topic, and it doesn't seem to be going away soon. We've been talking to Dr. Robert Hamm, and we're talking about the mental health and the aging of the male. And it's a big topic with a lot of people, well, half the population.
Roughly, yeah.
And if you're more interested, you can see Dr. Robert Hamm in his office in West Hartford.
Mm-hmm. Yeah.
And the phone number's at the bottom of this screen. And thank you very much, Dr. Robert Hamm.
Thank you, Pat.
Very good to speak to you,
Okay.
as always.
Okay.
Thank you.
Thank you.
Thank you.